Hello, my name is Lisa McManus and I'm a physical therapist. And I'd like to welcome all of you attendees here today. And I'm happy to be talking a little bit about rehabilitation after cancer treatment. We're calling it the road to recovery, but it's really a journey. And we want to all be participants and help you make this journey and have the best quality of life as possible. Cool. So today we're going to be discussing the side effects of treatments for various women's cancers. We're going to review the role of physical therapy and rehabilitation in addressing consequences of cancer treatments that affect the quality of life. And we want to understand the role of your interdisciplinary team in your survivorship plan. Okay, so we're going to talk a little bit, like I said, about the types of women's cancers. The most common you can see on the slide are breast cancer, lung, colorectal, uterine, and thyroid. And these other cancers that affect women are the gynecological cancers, which are those that start in the women's reproductive organs, including the uterus and the ovaries, vaginal and vulvar areas. And the kind of treatments that are used with these cancers include a vast plethora of treatments, and they're growing all the time. So it's important that we understand the side effects of these. They include the traditional chemotherapies and radiation, surgical interventions, and then the new hormone therapies and immunotherapies. Some of the more common side effects of cancer treatments can be pain with joint aches, can lead into fatigue, increased risk for cardiovascular disease because you're not as active, maybe, not feeling well to do your normal daily activities, hair loss or weight change, bladder and bowel dysfunction. So you may suddenly start, having to go to the bathroom much more often or have bouts of diarrhea. Some of the sexual side effects are vaginal dryness and decreased sexual desire, lymphedema, bone loss, or what we call like osteoporosis, what you've heard, and then neuropathy, which is a change in the way you feel with like your hands and feet. If you start feeling numb or tingling sensations or even pain in your limbs. So we're going to talk about some of these a little bit more. The most common side effect of cancer and its treatment is called cancer-related fatigue. And it's caused from chemotherapies or hormone therapies. It can cause inactivity. You can lose muscle mass. And when you're not as active, you don't sleep as well. And this can really lead to depression. And then it's a never-ending cycle of not being able to feel your best. It contributes to decreased aerobic fitness and your strength of your body. And in the end, your ability to perform your activities of daily living. So sometimes people describe it as feeling drained or washed out. I don't have any motivation to start anything new or finish what I started. It may get better and worse, wax and wane. And like I said before, it can interfere with the ability to complete daily activities, including your own self-care or being able to return to work or do the things you like to do. How can we handle cancer-related fatigue? The most important thing I tell my patients is that resting usually doesn't cure cancer-related fatigue, but you want to plan your day to maximize your energy. So you don't want to start out full tilt in the morning or you'll use up all your energy and not be able to finish out your day. So get moving with an exercise of your choice and take short rest breaks throughout the day. Make sure that you're sleeping well at night and get good nutrition. Good sleep hygiene is really important to combat fatigue. And so I want to just give a shout out and say to everybody, turn off your screens at least an hour before you go to bed. So no iPad, no iPhone, no games, no looking on Facebook. And you'll really be surprised that that blue light can have effects on your sleep cycle. The next side effect of cancer treatment that we're going to talk about is osteopenia or osteoporosis. And those are just fancy words to say that some of the calcium and minerals in your bones have been depleted due to the treatments that you've undergone. A lot of these treatments of hormone therapy or treatments following breast cancer where you're on aromatase inhibitors will drain those natural minerals from your bones and make them more prone to fracture. You may also notice that your spine kind of curves, you know, when we all get older because we're used to kind of slouching. Well, this way you can't get back up because your bones that are in your vertebrae or your back have kind of compressed a little bit and gone down into this curve in your back. So that may also be something that you notice. So how do you manage and prevent bone loss when some of these treatments are absolutely, you know, essential for your well-being and health-wise? So the important thing to know is that bones respond to activity when we're up on our feet. So weight bearing is vital. If you've ever heard those stories about astronauts that go out into space and when they come back, they've lost massive amounts of bone. So they have to start a program to build those bones up again. So that's what happens. If you're not putting weight on your feet, your bones are losing density again. So start a walking program or a weight-bearing exercise program. You can add strengthening exercises for your spine and your long bones, or you can consult a physical therapist for safety, progressing your exercises. So you can also discuss with your oncologist if you need medications or dietary modifications to manage your bone health.
Hi everyone, I am Gauri Varatkar and I'm a physical therapist at City of Hope. And I'm going to talk to you today about some of the side effects of cancer treatments and how we can take charge and take control and handle these side effects. So I'll talk to you first about bladder and bowel dysfunction. And some of the treatments that you undergo, like hormone therapies, for breast cancer when you get the Arimidex and the tamoxifen therapies, or some of the surgical procedures that you may undergo, such as a hysterectomy, where your uterus is taken out, or a oophorectomy, where your ovaries are taken out. Any of these procedures and treatments cause a depletion or a reduction of estrogen in your body. And what that does is that causes premature symptoms of menopause. As a result, you may find sometimes that you may have, you may just need to rush to the bathroom too soon, or you may find yourself leaking while trying to get to the bathroom. You may find yourself going to the bathroom a lot during the day, or you may be getting up a lot at night. And some of these symptoms, I want you to know that it's okay, and these are a part of the treatments that you're undergoing. Sometimes radiation treatments can cause fecal incontinence, which means a lack of ability to control your stool. The bowel linings get irritated and inflamed as a result of radiation, so the stools become more watery, it becomes hard to control, and you may have diarrhea. So in that case, these problems persist, but that doesn't mean you have to suffer in silence. We can help you manage these symptoms. And what you can do is, first of all, take charge. You can change your behavior with respect to your bladder and bowel habits. So modify your fluid intake. Try to see what you're drinking. Are you drinking sodas? Are you drinking caffeine? All of these are bladder irritants, alcohol. You may want to reduce some of that fluid intake in your daily intake, and maybe increase the water intake if you can. If you do not like the taste of water, try some flavored waters. Have a regular schedule for eating. Try to eat at regular times. Try to eat cooked foods, which are easier to digest than raw salads, which become a little bit harder to digest when you've had radiation. You can also discuss with your oncologist if you need more help, because they can actually refer you to a pelvic floor physical therapist, and they can give you more individualized help. They can give you more individualized guidance on how to handle these symptoms. As a physical therapist, I have prescribed to my patients pelvic floor exercises to strengthen the muscles, to improve your control on your symptoms. Also in pelvic PT practice, therapists use biofeedback or electrical stimulation just to enhance their results. Another less talked about side effect is sexual dysfunction. And people don't want to talk about it. Women don't want to talk about it. And it happens because of, again, the hormone therapies, the surgical procedures, the estrogen depletion or deprivation that you have to undergo in order to combat your cancer. But what that causes as a side effect is you have decreased libido or decreased sexual drive. And it is not helped by having the dryness in your vagina or having a lack of lubrication or having pain with intercourse. Also, sometimes radiation can cause the vaginal opening to dry, to tighten up. And the smaller opening causes increased difficulty with the penetration of part of the intercourse, and that can make it harder. Plus, some of the physical changes in appearance, they don't help. A lot of women have talked about, the decreased self-confidence when they have had a mastectomy or they have had weight gain or weight loss or hair loss. And all of this can affect your relationship and affect the sexual aspect of your life. So again, you do not have to suffer in silence. There is help and you're not alone. So talk to your oncologist, even though this is a topic that many women don't want to bring up. Discuss with your survivorship care plan nurse when you meet with her. Ask her who can help, who can you be referred to for help. Pelvic floor physical therapists are able to help in some of these situations. We can prescribe an appropriate stretching program to reduce pain during intercourse. We can also help with dilator therapy to help with the pain during intercourse. Alternate positions can be tried. And also using adequate lubrication can make it a little bit more comfortable experience. Also, beyond a pelvic floor physical therapist, a psychotherapist or a couples therapist, a counseling session might be beneficial to reconnect with your spouse. And together as a team, this can be helped. Lymphedema. I mean, we've all heard about lymphedema. What is lymphedema? So lymphedema is accumulation of, it's not just water that accumulates under your tissues. It is this protein-rich, thick fluid that is accumulating under your skin in the subcutaneous tissues and makes your limb feel heavy and hard to move and just really hard to manage. It can affect the limb, it can affect your trunk, and usually it is caused by surgery where your lymph nodes need to be taken out. And you must have heard a lot about lymphedema in women after breast mastectomy and lymph node removal surgery. It does also happen after pelvic surgery, after lymph nodes are removed from the groin or from the pelvic area. So the legs swell up after that. Makes it really hard to walk. It can also make it hard to move the joints in the legs. Sometimes it can come on months to years after the treatment. So it's something to be aware of, and it's something that can be helped. How can it be helped? So first, be aware that lymphedema can happen. If you've had radiation, lymphedema can happen. If you've had lymph node removal surgery, lymphedema can happen. So if you feel, even if you don't see a swelling in your limb, but you're feeling a heaviness in the limb, that's the first sign that there may be a beginning of accumulation of the lymphatic fluid. So talk to your doctor and ask to be referred to a certified lymphedema therapist. They can assess you and decide if you actually do have lymphedema. And if you do, they can prescribe a very methodical program to help address it. They usually will prescribe a manual lymphatic drainage, a massage, as a specific massage that helps to reduce lymphedema. And they can also then teach you how a compression bandaging or wearing compression garments during exercise that can help to keep it under control. They can also teach you actually some of the exercises. So there are myths. People think that you should not be exercising the limb with lymphedema, but actually active muscle movements help to reduce the fluid accumulation in the limb. So they can teach you on what exercises are right for the limb. Another thing that's important is to avoid trauma to the affected limb. So the lymphedema therapist can actually teach you on what is safe and what is not, how to avoid avoiding blood pressure coughs, avoiding certain movements. So it's a good idea to visit with a lymphedema therapist for more detailed understanding of how to manage this condition. Neuropathy is another side effect that is not talked about as much. Usually caused by exposure to chemotherapies, certain chemotherapies like taxanes, platinum agents. You'll hear all kinds of names from your oncologist. But it's just important to have the discussion with your doctor and just to know that you are at risk for neuropathy from the type of chemotherapy you're receiving. Usually you'll feel it as a tingling or a numbness coming on in your hands and feet. You may get some burning, some pain sensation, and it can make it really hard sometimes to sleep at night because of that constant pain or tingling. If you've had it, you know it. And sometimes the numbness can make it hard to walk, or you may find yourself dropping objects, or you may see that your handwriting is changing. In that case, you do need to speak to your oncologist about these symptoms. And it is important to talk to your oncologist because with neuropathy, unlike other side effects, if you can take control of it early on, you can significantly improve your chances of recovery from neuropathy. So your oncologist, first thing they might do is adjust your chemotherapy dose. Second thing they might do is recommend certain medications to help manage your symptoms. And then they may also recommend you to see a physical therapist. What we can do in our clinic is that we can prescribe specific exercises for small muscles of your hands and feet to actually improve circulation and mobility in those joints. We can also teach you some desensitization techniques. Desensitization means just normalizing those abnormal sensations that you're getting from the hand or the foot and making them more acceptable to your brain. So you can utilize different textures, like rough and smooth, or you can utilize beads, beans, or different temperatures like hot and cold, and actually try and normalize those sensations. What we can really also help with is balance exercises to make sure that you are not falling because of the numbness in your feet. Also, there's a new therapy called Kalmari therapy or scrambler therapy. It's an electrical stimulation type of technique. You see that in the picture over here in the slide. And it's offered in certain pain clinics. It is offered in the rehab department at City of Hope. And if you're looking specifically for this treatment, you do want to look it up on the internet and understand a little bit more before you also talk to your oncologist, because not every clinic will have it. But this can help with managing the symptoms of pain and burning and numbness for a significant amount of time, a little bit more than other modalities have. So it's definitely worth exploring. And then along your survivorship journey, lifestyle recommendations are very important, because how you are gonna lead the rest of your life now that you have beat cancer is very important. And a lot of large-scale studies have been done in breast cancer patients, mostly, on what are the outcomes of changing your lifestyle habits. And what they have found is that there is increased long-term survival, there is decreased morbidity, that means decreased, increased chances of living longer, and then reduced incidence of cardiovascular disease, reduced incidence of high blood pressure, diabetes, stroke, as well as improved overall quality of life when you follow a healthy eating, active living, and an emotional resilience type of lifestyle. So what is that? Healthy eating. In general, what's found that having a more plant-based diet, reduced red meats, reduced saturated fats, higher fiber in your diet does lead to long-term health. Trying to exercise more regularly, having 30 minutes of exercise at least 5 times a week is helpful. And you want it to be a moderate intensity exercise. You want it to be an exercise where you feel the work of walking, or you feel the work of biking, or you feel the work of the type of exercise you've chosen, but you can still hold a conversation. So it should be a little bit more than just a regular stroll. But an exercise with moderate intensity like that, 30 minutes a day, 5 times a week, has actually shown to reduce your chances of cancer recurrence and improve your chances of long-term survival. And then emotional resilience, that does not get talked about enough. A lot of cancer patients, a lot of breast cancer patients have been found to struggle with depression as they go through their cancer treatments and even after they have completed their cancer treatments. So if you are feeling any symptoms of depression, if you're feeling these symptoms, you do need to talk to your doctor. You need to discuss with your doctor and know that there is help, because cognitive therapy, psychotherapy, counseling, medications, there's a lot that's available to help you combat depression and actually get back to enjoying life again. And even though I'm talking about breast cancer, it's just that there's a lot of research done in breast cancer, but that does not mean it cannot be applied to other cancers if you don't have breast cancer. I think till we can find enough research in other cancers, you can start applying what's available for any other gynecological cancer that you're recovering from. So that's a good takeaway, is now that you have beat cancer and you are beyond it, how do you conserve and enhance the life that you have? And this healer lifestyle has found to be somewhat beneficial. So I think it's worth giving a try. And then as you are looking at this, you've probably seen that there is a whole team here ready to help you on your recovery journey. In addition to your oncologists, is physical therapists and occupational therapists, rehab professionals who can help you with regaining your quality of life. But also, when you're trying to follow a good diet, feel free to get advice from a nutritionist. When you are struggling with depression, feel free to get advice from a psychologist, from a psychiatrist, from your counselor. Struggling with it's your right to have the fullest and lead the fullest life that you can. So don't be shy, or don't be afraid of talking to your doctor about sexual issues if you're having. There is help available for that. If you are needing more help than your oncologist can offer, there will be a social worker on the team, on your cancer rehab team, or on your cancer professional team, who can also help you with financial issues or with other issues beyond the medical professionals. In general, as a team, we can complete the survivorship journey together. Thank you so much for listening to us today, and we hope to see you sometime.